Hello and welcome to another segment of the Fitness Whisperer. Thank you for joining me. So today we're going to talk about exercises that you can do to help repair damaged muscles, damaged ligaments, etc. Today's going to be more along the lines of a physiotherapy approach. Okay, so the reason I'm actually talking about this particular subject matter today, I got another email from a viewer who said that they've injured their shoulder and they can't afford a physiotherapist. They don't have medical coverage through their employer. So they were just asking me different techniques that they can use to help repair their shoulder. This particular individual had a chronic shoulder injury. And what I mean by that is that it didn't exactly go away. She's had this for about 7 years. Certain times during the year, it would flare up and then it'll kind of ease up again and it'll flare up. So when it did flare up, this person was just taking muscle relaxants, ibuprofen, and codeine to help ease the pain. So, and as we all know, those drugs are just band-aids. They don't exactly get to the issue. So today I'm going to talk about different ways people out there could help themselves fix a shoulder injury, may it be from after shoulder surgery, and you're a little bit restricted in your movements, like coming up this way or coming forward. People who have suffered knee injuries, may it be from playing a sport or slipping and falling. So let's dive right in. So before I begin talking about different techniques, I want to just kind of set the tone here. So what I'm going to be bringing up or talking about a lot, or the phrase I'm going to be referring to a lot, is something called proprioceptive receptors. Now, for those of you out there who don't know exactly what that is, I'll give you an example. So, and I'll just use the gym because I'm a personal trainer, so I'm going to talk about the gym, obviously. So let's say, for example, and I'm sure a lot of you out there can relate, you're doing a bench press. Now, do you remember the first time you did the bench press, free weights? You know, you laid down on the bench, you didn't have any weight on the bar, and you just lift the bar up. And as you had the bar up in the air, you were shaking a bit. You were just trying to learn how to figure out how to balance the bar. Or when you were doing flies for the first time, you know, you just had a little bit of an issue balancing. So what that is, are those are actually sensors in your muscle that controls balance, and it also controls flexibility. So if your muscle is stretching a little bit too much, it sends a signal to your brain to let you know that, you know, I don't want to tear. Please shorten up this range of motion. Those sensors are called proprioceptive sensors. So very, very important. With that said, let's start talking about shoulder injuries. A great way to help yourself feel better after a shoulder injury is to simply do this. I don't want to say get a specific weight because I know it varies depending on the individual. So I want you to gauge it this way, okay? I'm going to use 8 pounds for an example, but if 8 pounds is too heavy, go down to 5. If 5 pounds is too light, go up to 8. If you feel pain, it's too heavy. If you feel a little bit of resistance, then that's pretty much fine. You don't want the weight to be too light and you don't want the weight to be too heavy. If you're restricted coming up this way, if this is where the pain is, get an 8-pound weight, grab it this way. So you want to grab it overhand, sit up, nice straight back. The weight is going to be along the side of your leg and you're just going to bring it up slowly to about a 45-degree angle. Now, if it's painful, when you get to the point where you usually have an issue going up any further, if you feel any pain there, drop the weight down to 5 pounds, okay? You do want to feel a little bit of a resistance. So like I said, bring it up to 45 degrees and just hold it. So what's going to happen right away is you're going to start to shake a bit. So those proprioceptors are going to be firing off and you're going to be shaking, okay? Hold it for 5 seconds and then release. Give your shoulder a break. Count to 5, bring it up again. Shake, you're going to feel the shake, hold it for 5 seconds and bring it back down again, okay? So you want to repeat that 5 times. If you have an issue coming up this way, if you can't come up too high, okay, same thing, get an 8-pound weight, come up to a 45-degree angle and just hold it. Same thing, you're going to feel that shake, hold it for 5 seconds, bring it down. Same thing, count to 5, come back up again, and hold it for 5 seconds and you're going to feel that shake, okay? The shake is important because those proprioceptors that are firing off, sending a signal to your brain saying that I'm having an issue balancing this weight, What that also does is that it also helps and goes a long way in repairing that particular damaged muscle or ligament. Those sensors are stimulating that injured part of your body, and it will help to repair it. So what I would like you to do, after you've done 5 sets of that, what I would like you to do is try to see, without the weight, if your range of motion has increased, right? So what you want to do, and I should have said this in the beginning, but that's fine. Before you start this therapy, just see what your range of motion is first. I mean, you probably know how far you can go before it gets painful, this way or this way. Do what I showed you. Do that 5 times. Count to 5 seconds. Hold it for 5. Count to 5 seconds and repeat. After you've done that routine, let your arm or shoulder rest for about 20 seconds and then try to check out your range of motion. See if you can go any further up or see if you can go any further upwards. And I guarantee you that your range of motion would have increased just from doing that one particular exercise. Guaranteed. You would feel better. The pain might not go away, but I guarantee you your range of motion is going to be 20 to 30% more than what it was before you started that exercise. Guaranteed. Okay? So moving forward, because I mean your range of motion is probably going to get restricted again. So moving forward, you want to repeat this exercise at least 3 days a week. Do it for about 16 weeks, 4 months. As the shoulder starts to strengthen, of course, the 8-pound weight is going to start to feel a little bit light. So that's an indication to you that you want to go up a little bit higher, maybe up to 10 pounds, right? But again, proceed with caution, okay? Because you do not want to injure yourself. This particular therapy that I just showed you should not be painful. Of course, you're going to shake, but you do not want to be in pain, okay? Pain is not a good thing. The shaking is great, but if you feel any pain, come down in the weight. It's not about the weight. It's about technique and repairing the shoulder. Be very, very conscious about the weight, and you do not want to overdo it, okay? So that's it for the shoulders. Now, if you have a sore knee, now this might be a little bit tricky especially for people who don't go to a gym. If you live in a condo and you have a gym in your condo, great, but you do need to have access to actual gym equipment for this exercise to work for your knee. We all know what a leg extension is. If you don't know what a leg extension is that machine that you sit in and then you just kick your legs out this way and you just come back, right? You're extending your legs out and back. The same thing applies. Put it to about, and again, you want to gauge it, 20 pounds. The knee that's injured, so let's say, for example, it's your right knee. So you want to just extend the leg. You don't want to go to 45 degrees because you don't want to lock your knee out. You want to go as high as you can just before the knee gets locked and hold that. Now, same thing, you're going to feel that shake. You're going to feel those proprioceptors working. Count to 5, bring it back down again. Count to 5, take a break for 5 seconds and repeat. Same thing, you want to do that 5 times. If you start to feel any kind of pain in your knee, you know the weight is too heavy. So gauge it by pain. Like I said, you want to shake, but you do not want to be in pain. The idea is you want to get that shaking going. You want those proprioceptors to fire off, because as it's firing, it's sending signals to that damaged part of your knee, the ligaments or the muscles around it, and it will go a long way in repairing your knee. All right, so do that. Same thing for 4 months, 3 days a week for 4 months. You want to do it in increments of 5 sets. And same thing, like I mentioned about your shoulder, I guarantee you, your knee will feel a hell of a lot better if you stick to this particular type of therapy for your knee. Guaranteed. For your neck, now that's a little bit tricky, but that's actually an exercise that you can do at home. So for your neck, it's pretty simple. It's not so much proprioceptors for your neck. What you want to start off is just see what your range of motion is, going from the left to the right and going up and down, right? And what you want to do is just make sure that your shoulders are nice and relaxed. And you just want to keep on extending from left to right with your neck, okay? Same thing, you don't want to feel pain. You just want to feel the stretch, especially at the part of your neck that's injured. And you want to just go up and down, okay? So you want to do 10 times in total, right? Count to 10 this way and 10 times in total this way, okay? All that's doing, and it's not so much an issue about proprioceptors when it comes to your neck, but you want to make sure that you're loosening those muscles around the neck, and it will help to repair it in the long run. 16 weeks, give it 4 months. Do that 10 times in total, 10 times this way. Count to 10 and repeat. You don't want to do 5 sets. You want to do about 3. Now, you don't want to be erratic as well. You don't want to go too crazy, right? Just nice and controlled movements, right? Stretch the neck out frontwards and backwards. And just make sure that you're nice and straight and your shoulders are pointing back. Do those exercises for the shoulders, for the knee, and for the neck. Be consistent. Do it for 4 months, 16 weeks. And I guarantee you, you're going to feel a lot better. Now, some people out there do have access to a physiotherapist. They have it covered under their medical insurance, which is fine. I don't have an issue with physiotherapists. But if they're not promoting proprioceptive responses to your injured knee or to your injured shoulder, you might want to think twice, or at least ask them about it and have them implement that into your physiotherapy. If not, you may want to consider seeing another physiotherapist. And what you might want to do is even go a little bit further. Listen, these physiotherapists are looking for your business, so just remember that. So you might want to interview these physiotherapists or these physiotherapy companies. Ask them if they know about proprioceptive therapy. That will go a long way in helping you to decide what physiotherapist that you need to go ahead and work with. Proprioceptive therapy. Find a physiotherapist that does that. If you can't find a physiotherapist that does that type of therapy, then the onus is on you to go ahead and do it yourself, because you can, right? And it's actually a lot cheaper too. So something to keep in mind. All right. So that is it. Fairly short video again, not very long. Once again, I'd like to thank the people out there that have been sending me these emails. Continue to send me these emails. Like I said, try to get back to each and every one of you within at least 5 to 7 days. I do get a lot. For those of you out there who do want to get a hold of me or contact me via email, you can reach me at thefitnesswhisperer_7@gmail.com. If you want to follow me on Twitter, you can follow me at The Fitness Whisperer. So that is it, folks. Thanks for watching, and bye for now.